Hello, this is Deepmala Mahla, Regional Director for Asia with CARE. One of our significant country programs is Bangladesh, where we have been working for the last 7 decades. Last year alone, we served 6 million people across the country. One of the important areas where we work is on ensuring that people get good quality, accessible and affordable health. Our main strategy is to work in collaboration with the government of Bangladesh at various levels and support in a way that ensures that the quality of services is good quality, and at the same time we work at the community level to make sure that women and their families have the information to come and access these services, they have the means to it, and they are supported by their families, husbands, in-laws and communities. So in this way we are working to ensure that the demand is high, and also on the other hand supporting the local authorities to make sure that the supply of health services is of good quality. In Gazipur, I had this wonderful opportunity to participate in this meeting which was led by the ward councillor, and on the same table it's so inspiring to see private sector, members of the community, some NGO representatives and various departments all sitting together on one table and planning to make sure that high quality health services are available to everybody 24/7. Isn't that amazing and inspiring? After that, we had a chance to meet a group of women with whom CARE has been working, and these women could very well, clearly, in a very articulate way explain things like what are the danger signs for a pregnancy, at what stage we should take the person immediately, how do we do it, where do we get the money from. That planning at the village and community level is the key to ensuring that we can support the community for better health from the infancy level. Also, at the same time, there's collaboration and integration to make sure that there's safe drinking water available for everybody. And I just have to share this experience working with these young girls, the energy on their face, the positivity and hope which they exhibit. And you keep hearing this word poribortan on, which means change. None of these young women, none of these community members ever once mentioned that somehow we hope change will happen, but they spoke about we are working towards making change happen. And that is the beauty of it. And in short, this is what CARE has been doing, this is what our achievement is, and this is our aspiration. Support the community, support the local authorities to make and bring the change which they prioritize for themselves.